Welcome to Back Pain 101. For the next 30 minutes, I'm going to walk you through a series of exercises that are designed to help alleviate the chronic pain that you might be suffering in either your neck, your shoulders, your low back, and possibly even your knees. To begin with, we're going to stretch the calves. The calves are so underappreciated, overworked, and never stretched. We're going to use a simple dumbbell and a chair. We're going to place your toes up on the dumbbell so as to create about a 30-degree angle. Now, if you don't have a dumbbell or if you have a step nearby, put your feet up on that step so that you create that 30-degree angle. And the most important part of this is to support yourself on the chair so that you're not trying to balance. When you do this, I want your knees locked out. Believe it or not, they always say don't lock your joints, right? But for this, I want you to lock your joints out. Because within the body, every muscle is connected to every other muscle, creating the kinetic chain throughout the entire body. So we're going to start at the bottom, your calves, and work all the way to the top. Typically, I have people stay here for 5 minutes. I would like for you to try to stay here for at least 3, and I know it'll be very painful, but try to work to at least 5 minutes. Okay, if you do that, as we're standing here, you're going to feel the stretch come from the calves, through the hamstrings, through the glutes, and into that lower back. It's going to start stretching your lower back within probably about 5 minutes, I think. And when you start to feel that stretch in through the lower back, if you can stay here long enough, it'll actually stretch through the middle of the back up into the neck. I've had people come to me several times with their disc slipped, and without any type of manipulation, standing in this pose for a whole 30 minutes will stretch the whole entire spine, all the muscles surrounding it, allowing that disc to slip in all by itself without having anything to do with any manipulation. Okay, it's a very non-invasive corrective procedure. So I'm going to keep talking and you're going to keep standing there, and can you start to feel the stretch?
Absolutely.
Yeah. Yes. Now, where do you feel it most?
The backs of my calves.
Backs of the calves. A lot of times people will say that it's not getting past their knees, and they've been there for about 5 minutes. If you don't get a stretch that goes beyond the knees, the backs of the knees, on the first time, that's okay. It might take you a few times because your calves are so overworked in order to be able to get to the hamstrings, to get to that low back. Now, a lot of times, as a modifier, you may have to shift your hips a little bit to the rear so as to allow that stretch to be a little less aggressive. If it's still too aggressive, it's okay to let your feet slide down that dumbbell or that bench just a little bit if it's too much. Guys, especially guys, this is not intended to be an aggressive stretch. These are passive stretches and exercises. Don't go crazy on the first time thinking that, okay, I've get that best stretch. Because what happens with a muscle, if you stretch it too tight for too long, and when you come off of it, it'll snap back. And then you'll have defeated the purpose, right?
Right.
So we want to do a passive stretch. Now, I want you to, we've been here for about 5 minutes, I think. So I want you to step off, get the blood flow going back into, right? Yeah,
Yes.
It feel a little better, yes? Okay, so now we're going to work the top of the neck and the shoulders. I want to have you take your hands, clasp them firmly, place them behind your head. Very good. And then I want you to just, yes, right there, right about the crown, back of the crown of the head right there. And then you're going to squeeze your shoulder blades together so as to keep those elbows out nice and wide, okay? Now, you'll notice, I'm going to turn JD just a little bit to the side so you can see some things. JD works out a lot, don't you?
Yes.
You teach a lot of classes, you do a lot of different things.
Get tightened up easy.
Right, exactly. So it doesn't matter if you're in great shape or if you're a retiree or if you sit behind a desk all day. We all suffer from a lot of the same things. We cause our own problems and pain, right? Now, if you'll notice, JD's rib cages are a little bit elevated from her belly. You can actually see them from here. I can see them, right? They should normally be a little bit down here, but because her chest is really tight through the rib cage, we need to get those to open up. So you can see that her rib cage is pretty tight. As well as it's causing a little bit of tightness is her latissimus dorsi. That's also causing her ribs to want to pull forward, as well as, just for a second, release your arms. You can see her shoulders slightly round forward a little bit, and even her head just kind of put forward, yep, is slightly, the ears are a little bit forward of where the shoulders sit on her body. The head should actually migrate backwards, the shoulders should sit back, should have a nice lumbar curve, and then the hips should have an anterior pelvic tilt, just very slightly, but nonetheless. Go ahead and put your hands back up, okay? Because we want to hold this position for about 3 minutes. While you're holding this position, I want you to breathe about 30% more than you would normally do. Not too deep, I don't want you to hyperventilate, but just a little bit longer than you would normally do, okay? So as you do that, it's going to open up the rib cage. You're going to literally, when you're done with this, you're going to be able to breathe better. It's going to open up the lymphatic system, allowing the body's toxins to drain from the body, as well as it will help you lose a little bit of weight if you're looking to lose weight, right? Great. It'll help alleviate improve the immune system. It'll do a lot of beneficial things for you, okay? So now, we've done that for about 3 minutes. What I would like you to do is I want you to take your fingers and clasp them really tight at the knuckles. So you're out there just like this, okay, really tight. And then your thumbs out forward. I want you to stick them out to your side. Go ahead and face the camera. There you go. Yep, there you go. Turn your thumbs facing forward. And I want you to give us some nice big arm circles, about 20 of them forward. Nice speed, very good. Very nice. After about 20 of those, I want you to reverse that, and you're going to point your thumbs backwards, and then you're going to circle them in reverse.
I'm sure that was 20.
That's about 20. I wasn't counting. Go,
Thumb down,
yep, thumbs backwards. Give me 20 circles backwards. Very nice. Very good. And that's about 20. Now, take those same tight knuckles right there, and I want to place them right on your temple, right there at the temple level. Now, your head is straight forward, okay? And now I want you to touch your elbows together and then open them up. Touch your elbows together, open them up, and do that for 20 repetitions.
All the way wide?
All the way wide, all the way closed. Very nice. Make sure that you keep your knuckles on the temples. Keep those knuckles tight. And you'll notice, can you feel it opening up your back? You should feel it straining your back to pull it open. If you cannot get your elbows to touch, really work very, very hard to accomplish that over the next few times that you do these exercises, because it's very, very important to get those elbows to touch every single time. Very good. Very nice. Now that we've done that, we've done the arm circles, we've done the hands behind the head, we've done the elbow touches. Your head is already starting to loosen up and start slowly migrating backwards. I can also tell, if you turn to the side, just relax, your shoulders are already starting to pull back. The other thing that I can tell whenever somebody has weak shoulders or they have improperly rounded forward shoulders is the scapula tends to protrude from the back, from the spine. It literally should be flat. If I just take this, rotate it slightly, everything should be flat there. If a person is relaxed in their relaxed state and I see their rib cage or their scapula just protruding slightly, that means that they've got weak back, weak neck, and they probably suffer from neck pain. Okay, go ahead and turn around. Okay, now that we've done that, we're going to go down and we're going to do a few push-ups. Okay, so grab a mat, come down to the ground. And now these particular push-ups are very, very special. They're not your typical bodybuilder push-up, okay? I want you to assume a push-up position on your knees. All right, slide your hips forward, Slightly forward, a little more, a little more, a little more. There you go, good. Now, notice that she's pulling her belly button in, keeping that nice, correct spinal alignment. The hips are engaged, the hip flexors are engaged. And again, we can tell by the protrusion of the scapula from the spine that she has weak shoulders, and we're going to work on that. But she's keeping her head at a very nice neutral position. Now, with this position, I want you to literally collapse your shoulders together, push them together, pinch them really hard. Now you can feel those shoulders pinched there, right? Yeah. This is your start and your stop point. I want you to go down and give me a push-up. Now I want you to keep those shoulder blades together as you push up and stop right there and go down and give me 10 push-ups. Keeping those shoulder blades pinched together at all times. Now, as you do this, you'll probably notice you're actually feeling your chest. You're also really isolating your triceps doing this, because you'll notice her elbows are starting to push, they're pointing to the rear towards her hips, almost like what you would think of as a tricep push-up. But this is designed to take the shoulders out of this motion, because we tend to overcompensate with our shoulders, overusing them, causing shoulder pain. And most women, they are very susceptible to injury, are they not? A lot of women suffer from shoulder pain because they injure them, because they overuse them. So we're going to work the chest, work the triceps to make you stronger overall, right?
Yes.
Okay. Now, I want you to give me another 10 push-ups. All right, squeeze those shoulders in. Squeeze those shoulders, there you go. Remember, keep your abs pulled in, your belly button pulled in, keeping that nice lumbar curve. Touching the shoulder blades, bring those shoulder blades. You should be able to touch a pencil between those shoulder blades. Come in, bring them all the way in, pinch. There you go. Now, give me 10 more push-ups. Very nice. Keeping those shoulder blades pulled in the whole entire time. Whenever you're pushing, I want you to think about your back. Focus on keeping those shoulder blades pinched. This will isolate your chest and your triceps. Keep those shoulder blades touching.
Ow.
Yeah, it's getting a little harder to do the push-ups now, yes?
You're pushing me down, especially.
Push those in. Keep those shoulder blades touching. There you go. Keep them touching. It's a little hard. It's much harder to do this kind of a push-up than a regular push-up that you've done in the past, yes?
Yes.
Yes, much harder. Very nice. So now that we've done that, we've got those shoulders really fatigued, yes? So now we're going to go into what I call the pre-primal pose. So I want you to go ahead and lay down. And a lot of you might think of this as that pose that you see at a crime scene of a dead body, right? But this is designed to help neutralize the spine, put it back in its correct neutral position. So I'm going to place her so that we can see what you're supposed to look like, and then you try to mimic this at home. Pull this leg out, and I want you to put the pressure on the bottom of this heel, pressing it into the floor. So press that heel into the floor. And with her head facing in the same direction that her knees out, I want you to take your hand, place it down with the thumb pressed into the ground. So the elbows relax, but you're just going to press that thumb into the ground. I'm going to take the other hand, and I'm going to place this back, or actually up, towards the head, and we're going to press that thumb into the ground. I'm going to readjust your elbow just a little bit so you're at a 90 degree. Press that. Try to keep the elbow down. Pressing the thumb. Pressing the thumb. Now, as you're pressing your heel into the ground, you're going to feel that little bit of a muscle creep right through the glute. You feel that right there? Yes? Now you can see that her hip is slightly elevated above the floor, indicating that she has a tightness into the hips as well as the thoracic spine, not allowing the hips, when she's in this position, to be completely flat on the floor, as it should be. Also, we can tell that the right side of her rib cage in her back is slightly elevated in this position. We can also see that her elbow is slightly elevated off the floor. She's having a very difficult time putting it down there, yes? Mm-hmm. So as she pushes that down, you can feel that shoulder starting to burn on this side, especially on this side here. Yes? You feel a little bit of burn?
Nope, just the right side.
Just the right side's burning, yes. Okay, good. So we're going to cross balance the spine in this particular pose. After you've held this pose for about 3 minutes, and remember, 30% breathing, a little bit deeper than normal. Good, because that breathing from the inside out helps strengthen and stretch the muscles all at the same time. You still pressing that heel down?
Yeah.
A lot of times you have to mentally tell yourself, to remind yourself, press that heel down. Because if you're not pressing it down, it's not going to strengthen that hip to get it to drop down. How's that feel?
Tight.
Tight, yes? Okay, now I want you to come on up and switch around sides. I'm going to reposition you. So you do this at 2. Okay, now.
You're going to draw some tape around me?
We're going to draw some tape around you. Okay, good. So we're going to take this leg. We're going to press this heel down, right? You got it pressed?
Pressing.
This hand down. There you go. Press that hand down. This hand up. It gets a little confusing. Just think like an Egyptian and put yourself into that position. Make sure that you press that thumb down here, and your head is facing in the same direction as your elbow and your knee. Press that heel down. Now, which elbow which shoulder do you feel burning this time?
The left one.
The left one. Good. And you can see that now this side's slightly elevated, indicating that she is starting to strengthen this muscle through the subscap. And this side, she's really twisted on this side. It's probably a whole 2 inches. It's a whole 2 inches off the ground. Yes? So press that down. Do you feel the strain going through the glute on this side?
No, I
No?
think I might not be totally.
You no, you're good.
Is that right?
There you go. Just keep pressing that down.
Okay.
Okay. Press it hard.
Yeah.
Now, not everybody will feel the same type of symptoms or the same type of reactions in these particular positions as you would. So if you don't feel the same thing that she does, or you're feeling something different, it's okay. Everybody's body's going to react a little bit differently. How do you feel? Not too bad?
Not too bad.
So after you've been in this position, you're going to come up. Okay, go ahead and come up.
Unwind.
Good. And I want you to go back into a child's pose. Right there. Good. Yes. All right. Now, I'm going to slide you up just a little bit and reposition you. Go ahead, place your face on the ground. And notice I've got her hips slightly elevated so as to allow the low back, the lumbar spine, the thoracic spine to be able to be nice and flat so that it actually pivots at the hip. I'm going to place the elbows so that they're nice and relaxed out to 90 degrees and slightly inverted. And we're going to rotate those thumbs down and press those in. Go ahead up. Put your head down. There you go. Relax. Relax the neck. Press those thumbs down, elbows out wide. Now I'm going to press down just a little bit on her spine. So I want you to think about getting those shoulder blades again to pull together, flatten in the back, drop your hips just a little bit to the rear. There you go. Nice. Now hold that position. Now what we're doing is we're strengthening the thoracic spine, getting that ready for this next exercise we're about to do. Now, when you're in this position, I want you to breathe through that back of your belly about 20 times. Nice, good, deep breaths. Very nice. Good. Good, deep breathing. Don't hyperventilate. How do you feel?
Good.
You feel
I feel
through the shoulders?
stretch, yeah.
Yeah, you feel it through the shoulders. Very good. All right, when you've done your breathing for about 20 times, I want you to roll over onto your back. Very good. Nice. Okay, and then from here, what I want you to do is place your feet about hip or wider than your hips, and then your feet are straight right there, okay? Now, I want you to place your hands behind your head just like you did when you were doing it on the standing up. And then I want you to take both of your knees and drop them side to side, back and forth.
Keeping the feet on the ground?
Keep your feet will go edge to edge. They're good. They're very nice. And you notice her knees aren't going all the way to the ground. Yours may not either. They really should try to go all the way to the ground, but don't force it. I want you to breathe 30% more than normal, allowing the knees through the work of your hips to be able to get those knees to move from side to side about this speed. Very good. Now, what happens a lot of times is the feet will tend to creep away and it'll become easier to do. If they get too far away, you want to bring them back in to the original position because you're about an inch and a half, or about a foot and a half away from your glutes. Very nice. Keep your knees dropping from side to side. Good. Good. You feel it starting to loosen up your hips and work through your back a little bit? Very good. You should be starting to feel those hips loosen up as well. Very good. Just keep your heels. So you've done your 20, right? Okay, now I want you to curl your hip up, and then I want you to curl it back down. Now, here's the secret with this. Keep curling, and I'll explain. You're going to try to do this without using your quadriceps. So you have to use your belly button to curl it in and then arch it back. Curl it in and arch it back. And you're going to go back and forth about 20 times. Good. Just using your belly button, breathing about 30% more than normal, back and forth. Very good.
So not necessarily a big movement.
No, it's not a big movement. I want you to just get those hips moving front to back, just like we did with the knee drops. You're going to go in a range of motion that's comfortable for you without forcing the movement, okay? Good. You got your about 20 in there?
And close.
All right, good. Now, I want you to come to a prone position onto your hands and knees. We're going to do what's called cats and cows. Cats and cows, some people call them cats and dogs, but we'll call them cats and cows because we're going to arch her back up nice and high. She's got a very nice arch here, dropping her head down. Then we're going to go to a cow and go back up, dropping the low back down with her head up. We're going to go back and forth. We're going to transition back and forth a little bit faster than that, just to get the back to loosen up from those exercises that we did first. Back and forth, there. That's a great transition speed. And her back doesn't arch down very low, but when it comes up high, very good. And that might be what you experience, but you're trying to really push that back up and then drop it down very low. Very good. Good breathing through the whole entire exercise, and you're only going to do about 15 to 20 of those. Good. Nice job. Now, we're going to come down to the last exercise, and it's called the fetal position. So I want you to go ahead and drop into a fetal position. Everybody likes this one. Now, the secret with this is you have to be able to stack your hips, your knees, and your shoulders. So in order to accomplish this, make sure that you're sitting right on that shoulder, okay? The knees and the feet are all at 90-degree angles. The back should be straight. The shoulders are nice and vertically stacked. The head is relaxed onto the ground as best as possible. Your head may not reach the ground at this point because you're too stiff. That's okay. It'll drop. Take the bottom hand, place it on the top knee, pull your knees in so that you can reach just a little bit so that you know that you're at the right position. Take this top hand, you're going to take a nice deep inhale, open it up, and just let it fall, and let your head follow the hand. And then this spot right here into the waist, I want you to breathe right through that. So 30% deep breath, inhale, exhale, inhale, exhale. Very nice. And just focus on getting that body to inhale and exhale. You'll see that your hand will eventually drop to the ground. Eventually, your elbow will drop to the ground. And then hopefully, someday, your shoulder should drop to the ground. Because the hips and the shoulders are supposed to be able to rotate to a complete 90-degree turn. If you cannot do that, this exercise will help you reach that goal. And we just keep breathing and exhaling, breathing and exhaling. Don't force that shoulder down to the ground. If you do that, again, that's like taking that muscle, overstretching it, letting it go. Just like a rubber band, it'll come back and snap and it won't do you any good. So just allow it to do this. You can do this for as long as it takes, 5 minutes, 10 minutes, for whatever you feel or you have time for. But if you can do this at least a couple of times a week, you'll really feel that low back and that middle back release. Pull the arm in, and then we'll go to the other side. Good. Make sure the hips are stacked, the knees are stacked, pull them in to 90 degrees. The feet also 90 degrees and stacked. Good. The bottom hands on the knees, the shoulders nice and vertically stacked. The hand comes up, opens, exhale, let it fall. Very nice. And you'll notice that sometimes one side is going to drop much faster than the other. We all have left, right dominant sides and muscle imbalances. This exercise, or these series of exercises, will help balance out those muscles, return your muscle symmetry, and give you a much better overall feeling. I can see on this side, JD's elbow is much further off the ground, even though her hand dropped. Her shoulder still needs to be able to come down to the ground. We'll stay here for a couple of minutes, continuing the breathing, and her head will also follow her hand. How's that feel?
Good stretch.
That is a good stretch, yes?
Yes.
Good. Nice. Very good. Good deep breathing right through that spot right there. Very good. Elbows starting to drop. You can see, I can see your hands starting to come down. Yes, good. Very nice. Go ahead and bring it back in. And then after you twist the spine, we have to bring it back to neutral and straighten it out with cats and cows. So we'll just do 10 of them now. So we'll give a nice cat and a nice deep cow. Good. Very nice. Good breathing through the whole entire time. Like I said, if you will continue to follow these exercises at least once to twice a week, you're going to feel much, much better within the next 2 to 3 weeks. Typically, a person who's feeling some kind of chronic pain will see some difference just after the first time they do these. They'll feel much better. You'll probably even sleep better tonight. So I want you to keep coming back, keep doing these exercises, add them into your workout routine. It doesn't matter if you're a high-end athlete or a retiree. These exercises will work for you. Thanks, and come back next time.